So thank you very much. So I will begin with a quick introduction. So by saying that urinary tract infections are quite frequent in the ambulatory care. If we are observing the data from the Sentinella network, 23% of antibiotics are prescribed for urinary tract infection lower, and 3% for upper urinary tract infections. Here you have a graph on the sales data from IQVIA. The data are given in defined daily doses per 1,000 inhabitants per day. Defined daily doses is a metric which corresponds approximately to a number of daily treatment. It is an important metric in relation with the selection pressure and the development of antibiotic resistance. And I took here the main antibiotic given for urinary tract infection. And we can observe a shift in antibiotic consumption with a decrease of the quinolone and an increase of nitrofurantoin and fosfomycin over the last 22 years. And this can probably be explained by the guideline update. So in 2011, the IDSA, the Infectious Disease Society of America, and the European Society for Microbiology and Infectious Diseases published a guideline update for this acute uncomplicated cystitis and pyelonephritis in women. And the reason for the guidelines update was an increase of the bacterial resistance for fluoroquinolones and amoxicillin. And secondly, the FDA began to publish some warning alerts about the fluoroquinolones associated adverse effect. And actually, it was the beginning of a series of warnings for fluoroquinolone associated adverse effects. And this is probably the two reasons why we observed such a decrease in the fluoroquinolone use. And the second reason, so the reason why we observed an increase in the nitrofurantoin in Switzerland, there is a study from Angela Huttner from Geneva, which was published in 2018, and they could show that treatment of 5 days of nitrofurantoin was superior to a single dose of fosfomycin in this uncomplicated lower urinary tract infection. And this study led to a change in the SSC guidelines. So the recommendation for fosfomycin has been moved from the first line to the second line treatment. I spoke about the quantity of use, and now I will speak more about the appropriateness of use. This is here the result from the study of Jelena, which was published this year in the Swiss Medical Weekly. So she took the data from the Sentinella network, and she could show that the appropriateness of the antibiotic prescription in urinary tract infection was actually quite good, especially in the lower urinary tract infection, where only 8% was antibiotic which were not recommended. Mainly it was fluoroquinolone of newer generation. And 20% of antibiotics were not recommended for upper urinary tract infection. And it was fosfomycin and nitrofurantoin, which is not a good idea because these substances have not good diffusion in the range. And some fluoroquinolone of newer generation. Andreas Platte showed also the same in his study. He could also observe that the prescription was quite concordant with the urinary tract infection guidelines. He observed a bit more prescription of quinolone in the tessin, but actually maybe there is also a bit more older people in the tessin, so it's difficult to say if they have really a higher consumption, but he found some quinolones for lower urinary tract infection, which should be avoided. And then what can we say about the evolution of resistance rates, especially after the guidelines update? For the resistance rates for nitrofurantoin and fosfomycin remains very, very low since the guidelines updates, which is an argument in favor of choosing this molecule and especially nitrofurantoin as a first-line treatment. Then you have here the resistance rates for Escherichia coli in urine sample, I forgot to say. And here you have the resistance rate for for norfloxacin and the resistance rates for ciprofloxacin. And actually, due to the large decrease of use of norfloxacin, we could have expected greater decrease in the resistance rates of norfloxacin, but actually you have to keep in mind that it is not so simple. The clones are very persistent, especially because the mutations are very stable for the fluoroquinolone resistance. The resistant genes are often co-linked to beta-lactam resistance, and I didn't show here, but we observed an increase of resistance rates for cefuroxime, and the resistance E. coli widespread in wastewater and food-producing animals, and also international travel spread the resistance close. So it is better to prevent an increase of resistance rates by prescribing quinolones only when it is necessary. And in the IDSA guidelines, it is written that cotrimoxazole should only be used as empiric therapy when local resistance rates are known to be less than 20%. So are we doing wrong? Actually, our data by ANRESIS likely overestimate the true resistance rate because a clinical laboratory receives samples from patients with recurrent or complicated urinary tract infection, and mostly not from healthy women. And actually, it was the conclusion of Andreas Platter in his study that the susceptibility proportion of Escherichia coli to cotrimoxazole was about 86%, so a resistance rate from about 14%. So we are less than 20%. And this is my last slide. My chief, Andreas Cronenberg, liked very much when I promote ANRESIS guide. So here is the link. ANRESIS guide, you have an access to the SSE guidelines, and you can find some information about microorganisms and antibiotics. For that, by clicking on the antibiotic, you have all the microorganisms, you have some further information. And for the antibiotics, we collaborate with pharm for that. So thank you very much for your attention.